everyone, my name is Sienna with PMG, and today we are here with Dr. Westfall, and we're just gonna get to know him a little bit and see his philosophy and just ask him some questions. So, Dr. Westfall, thanks for being here.
Of course, great, happy to be here.
I got your coffee, we're all set to go.
Ready.
Okay, first question is, we just wanna know, how did you get into medicine in the first place?
Sure, yeah. So I went to undergraduate at UC Santa Barbara, just up north here. And, I did a major in biology. I think I always had an affinity for the sciences. I liked working with people. It felt like the best way to sort of merge the two and kind of just continue my education and find a career.
Did you know going into your major in biology that you wanted to be pre-med, or were you like, I love science, I'm going to do science?
I think technically it might have been classified as pre-med, yeah, okay. But being a first-generation college student, there was a little bit of doubt in my head if things would ever of progress that far. Mm-hmm. And then, everything kept working out and yeah.
That's awesome. So you graduated from UCSB, mm-hmm. and then where did you go to med school?
Med school was out at Turo University in Las Vegas.
Oh, nice. Okay, so you moved away from the coast?
A little bit further away. Yeah, not too far. And then landed back at Residency in Ventura and was fortunate enough to meet a lot of the local physicians in the area. And that's what brought me to primary medical.
Okay, so you are in Ventura. How long have you been out here then?
Back in Ventura, going on 4 years.
Okay, very nice. And so you now work at Primary Medical Group. We're super excited to have you. What would you say your main medical philosophy is?
I think a lot of the more new medical philosophy in mine as well, the way we were trained, is you want to focus on preventative medicine, as well as just try to be as evidence-based as you can. I think using anecdotal examples and experience you've had where things might have worked is helpful, but trying to just follow what's proven to work, what's proven to not work, and just try and use the most up-to-date studies that you can has been really helpful in discussing treatment plans with patients.
Would you consider your philosophy more of like a holistic approach?
Yeah, definitely. I think being a holistic approach, a preventative approach, you always want to start with the basic things that you can change in your life before, progressing to medications. I think it's great that they're there if you need them to, but I think in a lot of the most common medical diseases, especially in the US, is all lifestyle based. So I think the best way to sort of treat those, reverse the disease progression, stabilize it all really comes down to your day-to-day activities.
So when you say lifestyle and day-to-day activities, do you mean diet and exercise?
Diet and exercise, pretty much, yeah.
Oh my gosh. So if a patient comes in and, they have diagnosable diseases or anything, what would you usually tell them when it comes to their lifestyle and the holistic approach?
I think we would start at their baseline of what they're currently doing and what we can do to slowly change things. I've found that it's very hard for patients to just radically change things overnight, and they might be upset with their new path or sort of revert back to what they were doing prior pretty easily. So I think having good short, medium, long-term goals is the approach I usually take.
That's awesome. Baby steps. I love that. Okay, well, outside of the clinic, what are some things in Ventura that you enjoy doing?
Yeah, sure. I think we're in a really unique location here. I love spending time at the beach. I think there's a lot of really good hiking and trails along the coastline here. And then, of course, getting up more into the mountains and further east into the Sierras. So, I try and spend a lot of my time doing those things.
What is your favorite hike in the area?
Favorite hike in the area, I'd probably have to go towards Point Mugu.
Okay.
I think on a clear day you'll just get great views, north, south, just out into the ocean.
Is that a strenuous hike? Moderate?
There's easier ones kind of in that area, maybe a mile or less, but the Point Mugu one itself is kind of that renowned, pretty strenuous. Yeah.
Okay, awesome. So you enjoy just getting outside. So you practice what you preach as far as that activity and that lifestyle. Okay, awesome. Well, Dr. Westfall, thank you so much for being with us today. Dr. Westfall is accepting new patients at Johnson, and so if you're looking for a new physician, come join us.